Hello. Thank you so much for joining this session on an introduction to dynamic health. My name is Mia Bolton. I am the reference and instruction librarian for Mount Sinai Morningside and Mount Sinai West. Without further ado, let's jump right into our agenda. So this is our agenda for the next 30 minutes. We will review evidence-based medicine, the definition and the cycle. I'm sure it'll be a refresher for most viewers. We will then talk about dynamic health, what it is, give you a brief overview, and we'll touch upon the content within the database. And some of those include continuing education. You can obtain credits. There are also patient handouts, patient education handouts. You can overview some skills if you are maybe lacking in a particular area. There's information on drugs, and we will get into all of the other content shortly. We will then talk about how to access this resource through the Levy library, and it is the same process for any resource that you want to use through the Levy library. So we'll go over that. And then finally, we will walk through a demonstration of the database itself. Moving on to the evidence-based medicine definition and cycle. So the definition at the top here reads, evidence-based medicine is the conscientious and judicious use of current best evidence from clinical care research into the management of individual patients. So to put that in some more simple terms, it is the use of the best evidence from research to care for your patients. So it starts when an information need arises. That's the first step. Maybe you have an information need for research, or maybe it is for caring for your patient. You will then move to asking constructing a searchable and answerable question. And there is a framework that most are probably familiar with, PICO, that can help you figure out what pieces or components are important to your question. Although we won't go over PICO too much, it stands for population, intervention, comparison, and outcome. So once you know those details of your question, you are then able to put together that question. You then move to acquiring. So that's using the library resources to search for the current best evidence in the research literature. Once you have the literature that looks promising, you will then move to appraising that literature. So you want to make sure that what you are looking at, with the literature that you're looking at, is reliable, applicable, and best for your case scenario, whether that again is for research or caring for your patient. You are then applying that, ultimately applying, and then the cycle continues. So you want to make sure that you are looking at high quality evidence, high quality resources that have literature that is at the top of this pyramid. If we're looking at the bottom of this evidence-based pyramid, we see in vitro research, animal research, ideas and opinions. These kinds of literature are maybe not the best if you are trying to conduct something that, when you are caring for your patient, conducting research, going back to the evidence-based medicine definition, you want to use the best current evidence. And that is almost always found at the top of this pyramid. So a systematic review is something that takes months, sometimes a year, sometimes longer to conduct. So you know that those studies are a lot more rigorous. They have a lot more evidence backing them up, as say some animal research or in vitro test tube research. So the main goal here, looking at this slide, is that as you move up the pyramid, the evidence strength increases. So jumping into dynamic health, what is dynamic health? Well, it is a skills and decision support tool designed to foster a culture of evidence-based practice and critical thinking, ultimately providing resources and support to help improve patient outcomes. So it is a database, and there are a lot of different ways that you can use it, a lot of different contents within the database. And here are those particular categories. So within dynamic health, you can narrow your search based on the following here. And that is diseases and conditions, signs and symptoms, test labs, interventions, skills, and so on. I particularly find it very interesting to look over cultural overviews. Let's say you have a patient whose background you are not so familiar with. This is a great resource if you need to look into what their values are, what their preferences are, things that you should keep in mind as either a nurse or a physician. That is a great tool to learn more about what they care about. And the rest of the content here, we will take a look at when we jump to the database. Dynamic Health does offer continuing education. And when we get to the database, I'll show you what it looks like to kind of walk through creating an account. When you are accessing Dynamic Health through the Levy library, you will sign in through Open Athens, which is our platform that recognizes your Mount Sinai credentials and recognizes you as a Mount Sinai employee, thus giving you access. However, once you are signed in through the usual way of signing in through Open Athens, you will need to create an individual account that within that system. So that's what this looks like here. And as I mentioned, Open Athens is our platform for recognizing your credentials, giving you access to all of the library's resources. So while you're, doing your research, if you're in the library or if you're at home on your computer, this is how you would sign in to our resources. And I will also provide a walkthrough of that as well. All right, so with that, I believe that brings us to the end of the slideshow portion. So now we're going to jump into the database. And here I have some topics that we can look into. So when I am accessing the library, I usually type in Levy Library into Google, but you can also type in icon.mssm.edu. That will bring you to the library website. But we'll click here. And this is our beautiful website. And I'm going to scroll down to databases. There are many ways that you can search for resources within the library. I could have typed it into the top search bar up here. I could type it in here. I don't know why I do it like this, but I click on the databases, click on D, and then I scroll down to Dynamic Health. All right, so it's going to bring you to this page, which begins the Open Athens sign-on process. So you will always click this top option here. And then it's going to ask me to sign in. And then it's going to bring me to a half page or a 1/3 page. I'm going to sign in. And then it's going to text me. So that is the Open Athens sign-on process. Now, when I go back to the library website, if I want to continue searching, but within a different resource, I do not have to go through that process again. If you shut your computer, log off for the day, that will not be the case for tomorrow. You will need to do that process again tomorrow. But for the time being, while my mouse pad is active, you do not have to worry about signing in again. All right, so let's take a look at the tabs we have up here. I will click around through these tabs so you can just get a feel for what each landing page looks like. And then we will go through the searches that I have on the presentation, the slideshow. And then we'll look at continuing education here. Up at the top, we can search for diseases and conditions. And if you need a refresher, or maybe you have a patient with an issue that you're not familiar with, you can take a look at what that is here by browsing. You can type it in, or if you're just kind of getting a feel for what this database can do. Let's see. I am interested in this resource, and so it gives you a description, gives you red flags, things to consider, things to look out for, etiology, risk factors, prevention. You'll notice here that after each piece of information, we have a reference number. So if we scroll all the way down, we will see our references. So it gives us the reference here, but up at the top here, next to the number, it tells us what kind of research, what kind of literature it is. If you think back to the evidence-based pyramid with the systematic reviews at the top and the in vitro research at the bottom, you can kind of use that to inform your decision making on the literature that is here, published meta-analysis. So we know that these resources have, been vetted. They are very strong evidence-based resources. So I'll go back up and let's take a look at signs and symptoms. If you have a patient who is presenting to you in a way that you need to, learn more about the causes or what the issue is, then you can take a look here. It breaks it down by system. So we have circulatory, digestive, endocrine, and so on. So let's take a look at this one down here. So in this resource, this particular content here, we have some images, gives you a description, some red flags, care goals, care interventions, patient family education, causes and risk factors. And you'll see on the side here, it breaks it down for you. Going back up, we have tests and labs. So let's take a look at imaging tests. Similar to the diseases and conditions landing page, we can scroll through, see what's here. Let's take a look at bone scan. So again, we have an image here, what to expect, some more images. We have our description, red flags, preparation, care interventions, and so on. Let's take a look at lab tests. I am interested in activated clotting time test. Gives us a description, red flags, preparation, care interventions, and so on. So let's now jump to care interventions. And here we have it broken up by field. Let's take a look at neurology and neurosurgery. So here we have care interventions for particular diseases and conditions. So let's take a look at dementia interventions. So it gives you a description, gives us red flags, care goals, care interventions, interventions specific to certain aspects of the condition. So skills is another great tab here. So underneath nursing skills, we have specialties broken down for us. Basic nursing skills here. So let's take a look at wound care. And you'll see it labeled here as nursing skill. All of these are labeled as such. And let's take a look at applying elastic bandages to adults. So it gives us the purpose. They're used to exert gentle, firm, and consistent pressure on soft tissue. And it gives us some red flags. Outlines the procedure for us, the supplies we need, and the pre-procedure steps, as well as the procedure steps. Patient family education, post-procedure steps, and then documentation. So as I mentioned, cultural overviews is another great tool. We have outlined here different faiths and heritages. Underneath faiths, we have Amish, Buddhist, Catholic, Hindu, Islamic, Jewish, Latter-day Saints. And underneath heritages, you can see those here. Just to kind of, get a feel for what this looks like, let's take a look at the Indigenous peoples in Canada. So it gives us a description, communication, asking open-ended questions, regularly assess pain and offer pain relief, asking for consent, gives us an overview of traditional health beliefs and remedies. So again, just kind of gives you an idea of your patient's background, what they are thinking about when they come to you, and just some things to keep in mind so you both are on the same page. But of course, talking to them and communicating with them is also very important. So drugs here, very straightforward. We have A to Z list. Take a look at the drug, route and dosage, availability, indications, some adverse reactions, side effects, interactions, assessment, and so on. We have patient handouts as well. However, I do know that most departments have their own patient education, patient handout library. I will still show you this in case you need a backup. So let's take a look at acne. Causes and risk factors, possible complications, diagnosis, treatment, medication, procedures, skincare, prevention. So if you need a backup for patient education or patient handouts, then this is here. Moving on to leadership, we do have continuing education / professional development within this, this is not the continuing education portion, but if you are, interested in any of these topics here, then this is available as well. So looking at flexible scheduling, if you are in leadership, then this is a great resource to stay updated on best practices and things that have strong evidence behind them and that are proven to be helpful. All right, so with that, I feel like we did a lot, but I will still do a couple searches here. We can look up falls prevention. And here we have a couple different content types: nursing skills, treatment modality, health profession skills, lots of nursing skills. So if we take a look at implementing a fall prevention plan, we have the purpose. It reduces risk of patient falls, some red flags. We have the procedure, steps, the supplies, pre-procedure, and very similar to the things that we've already looked at. We also have a video for this one.
Post a fall risk sign visible to the staff. Keep the patient bed in a low position. Verify the bed brakes are locked. When transferring the patient from the wheelchair to the bed, verify the wheelchair brakes are locked.
So that is another great, educational piece to help you care for your patients in the best way that will work for you and them. All right, what else do we have on this list? Medication errors is another one. Let's take a look at preventing medication errors in pediatric care. We have another multimedia piece here. Gives us a flow chart for preventing pediatric medication administration errors. And purpose, red flags, and again, things that categories content within the content that we've seen. All right. So I did have a couple others on this list that I was planning to type out, but we are almost done. So I will skip those because we've done quite a bit of navigating this website or this database already. And I will jump to now the continuing education portion of this. So you will need to register for a personal account. It recognizes that I am affiliated with Mount Sinai. However, I do need to create my own account within this account so that it will start tracking my continuing education credits. I won't register now, but this is the process. And once you are signed in, it should recognize as soon as you sign in through Open Athens. So it tells you here what dynamic continuing education is, activity goals, and educational objectives. It tells you who is the accreditor. So if you are looking for continuing education, you can do it within Dynamic Health as long as your accreditor says that Dynamic Health is a resource where you can obtain those credits. I will also lastly I will now point you to the Levy Library's Continuing Education LibGuide. And here you can read more up on Dynamic Health. And then if you are having trouble, we do recommend that you reach out to Dynamic Health, their customer support, or they do have a handout here. All right, I'm going to stop sharing, and that is all for today. Thank you so much for joining, and I hope to see you at the next one.